you were?
大家好，我们现在要开始第二个讲座了。
Okay, you ready? All right, so this is one of my favorite topics to talk about, the endocrine theory of Beijing.
这个是克尔医生一个最感兴趣的题目，是内分泌治疗和衰老之间的关系。
So doctors used to believe that our hormone levels fall because we age, but now we know we age because our hormone levels fall.
过去医生们通常认为是因为我们的内分泌的指数降低导致我们衰老，而现在呢，医生会认为是因为我们对不起，我刚刚说反了。医生之前是认为因为我们衰老导致我们的荷尔蒙指数降低，而现在是因为我们的荷尔蒙降低导致我们的衰老。
So living longer maybe is not enough.
活得就是更长更久，可能已经不够了。
I hear many patients say, but I will stay young and healthy through diet and exercise. But hormones affect every area of your health. Hormones affect your metabolism. Hormones affect your energy, your mood, your emotions, your immune system, your risk of a number of diseases, heart disease, bone disease. Hormone affects your skin and your hair.
有的病人他们会觉得我可以通过膳食和运动来让自己保持年轻和健康，但是荷尔蒙在我们身体中它也起到很多作用，比方说它会影响我们的新陈代谢，影响我们的精力、情绪、免疫系统，心脏病的几率，还有骨骼、皮肤、头发的健康等等。
This is just a chart I like to show because it shows how much hormones have an impact on so many areas of your health. So everything in yellow relates to hormone replacement.
在这个图中，我们能看到，像黄色的这边是说荷尔蒙可以在这些方面中起到的作用，而粉色是营养，绿色是运动，它包括我们的身体的脂肪、肌肉，然后骨骼密度、皮肤的厚度，免疫力等等。
So what do we want to do with this anti-aging? We want to replace your hormones to a level of a healthy 35-year-old. We want to create balance, and we want to use bioidentical hormones. We want to give you back what you used to make.
一个健康的荷尔蒙治疗是把我们现在我们人的荷尔蒙提到我们35岁的程度，然后再通过定期的血液检查和健康的天然荷尔蒙来进行治疗。
So growth hormone is a very interesting hormone. It's considered almost a master hormone. It's made in your pituitary gland. And it may signal to the other hormones that it's time for them to dwindle as well. By the age of 60, most people will have a growth hormone level that is almost indistinguishable from a person with a pituitary tumor.
第一个重要的荷尔蒙就是生长荷尔蒙。生长荷尔蒙在我们30岁之后就开始下降了。这也是我们衰老的情况开始发生的时候。
So as your growth hormone levels fall, and you can see by the age of 35, you're on the downhill side of the curve, so changes your energy, your body composition, your brain function, your immune system.
我们从这个图表可以看到，大概从20多岁到30岁的时候，我们的生长荷尔蒙就会降低得很快，它会影响到我们的精力、身体的组成成分，比方说脂肪、水分等等，还有我们的大脑健康和免疫系统健康。
And you can see when we replace the hormones, we're not going to a very high level. When you're young, your levels are very, very high. We're going to a level about of a healthy 35-year-old. So you can see it's not that high.
我们从这个图也能看到，就像我刚刚说的，我们要把荷尔蒙调整的程度是到大概35岁的时候，所以您从图中能看到35岁的指标也不是非常高。
So if you look at the symptoms of aging and you look at the symptoms of pathologic growth hormone deficiency, meaning I have a tumor in my brain, they're the same symptoms. You have loss of bone, loss of muscle, loss of strength, loss of exercise capability, increased belly fat, increased risk of heart disease, changes in your immune system, and changes in quality of life.
这个是一个衰老和生长荷尔蒙缺失的现象的对比。比方说，在衰老中，我们有骨质疏松、肌肉减少，还有力量减少，心脏病的几率增加等等。在荷尔蒙缺失的情况下，这些症状也是很常见的。
So growth hormone, initially what they used to do is we used to treat children with growth hormone deficiency. So these were children that had a pituitary tumor. And we would treat these children until they were adults. And then we would stop treating because they had grown and we didn't think there was any other need to use growth hormone. So once you had reached maturation, growth hormone was stopped.
我们最开始荷尔蒙治疗是就是在小朋友中，因为在有一些脑部有肿瘤的小朋友中，他们能发现他们的生长荷尔蒙的指标非常低，但是他们在进行这个治疗中，他们即便回到了正常的水平，一旦停止了这个治疗，他们还是有很多现象发生。
So the first study done on these young adults, they took these children who were previously treated with growth hormone, and until they're adult, now they're off growth hormone, and their levels are going to dwindle down to their pre-treatment levels. When they looked at this group of now adult growth hormone deficient people and compared them to same age, same-sex individuals, this group of individuals had an accelerated aging.
像我刚刚说的，接受生长荷尔蒙治疗的一些小朋友，等他们长大之后，一旦他们停止了这个治疗，和他们的同龄人相比，他们就心血管病的几率就会增加2倍，还有像腹部的脂肪会增加，肌肉和力量就会减少，然后工作状态差等等。
Then they replaced growth hormone in these individuals for a year. All their symptoms of aging went away. They took it back. All their symptoms of aging returned. And that's when our FDA approved growth hormone for adults with growth hormone deficiency.
之后我们给之前的那些小朋友，就长大后的小朋友，又重新做了荷尔蒙的治疗，他们的生长荷尔蒙治疗，他们的指标又回到了以前，而且他们的症状也消失了。这也是 FDA 通过给成人的生长荷尔蒙治疗的时候，就是1996年。
So growth hormone has an effect on many, many organs. It has an effect on your brain. It helps your bone. It has a wonderful effect on heart function, your immune system, your body composition, your exercise capability, wound healing. It's great for fractures that don't heal. It has a wonderful effect on quality of life, and it even affects your skin and your hair and your cosmetic appearance.
生长荷尔蒙它会帮助我们很多方面，比方说大脑健康、骨骼健康、心脏健康，免疫系统、身体的组成、运动的能量，还有您的受伤之后您的伤口恢复的速度，另外还包括您皮肤啊、头发的视觉效果。
For every 40 milligrams decrease, we measure growth hormone by looking at something called IGF-1. So for every 40 milligram decrease in your IGF-1, there's actually a 38% increase in mortality and death.
我们现在说的是一个可以检测您生长荷尔蒙的指标的 IGF-1 的指标，然后这里有一个研究，它发现了每当您的 IGF-1 降低40毫克，您的就是这个 实验的人群的死亡率就会增加38%。
Again, as growth hormone levels fall, death rates increase, and these are death rates from heart disease and cancers.
现在这个研究说的是，生长荷尔蒙降低之后，我们死亡的风险就更大。这里面的原因包括心脏病还有癌症。
Growth hormone has a huge effect on your cognition, so it's great for your mood, it's great for alertness, it's great for your memory. It actually increases dendrite connections, which are connections between your brain cells.
生长荷尔蒙对我们的大脑也很有帮助，它会增加我们的认知能力、记忆力等等。
This was a study that was done where they were looking at growth hormone levels or replacing growth hormone in both normal aging and Alzheimer's patients, and both groups improved with growth hormone replacement.
这是一个这个研究是做的正常人和有老年痴呆症的病人在用生长荷尔蒙治疗之后的变化。实验的结果是两种人都有显著的变化。
This was a study that looked at does low growth hormone levels actually contribute to the formation of Alzheimer's disease, and they did find a correlation.
这个是说生长荷尔蒙和老年痴呆症之间的关系。研究的确发现它们之间是有关系的。
What about body composition? Growth hormone actually reduces body fat. It's a little bit better in men than women, but if you balance a woman's program with different other hormones, it seems to be pretty good. But in men, it's usually a 14% reduction in body fat. 14.
这里说的是生长荷尔蒙对减身体脂肪的帮助。通常男性比女性在这个治疗后更显著。男性在接受这个治疗中，通常会减掉14%的脂肪。
And growth hormone actually decreases fat around the organs. That's the dangerous fat that's associated with heart disease.
生长荷尔蒙它会帮助您减掉的是您器官周围的脂肪，这些脂肪是对您的健康最有害的。
Growth hormone is wonderful for bone density, so it improves your bone density.
生长荷尔蒙还会帮助您的骨密度，它会帮助您的骨密度增加。
Growth hormone is great for your skin, so it actually thickens your skin. It helps to prevent wrinkling, which you don't have, but we do. And it actually prevents cancer of the skin, so it helps to make the skin more resistant to skin cancer.
生长荷尔蒙还会帮助您的皮肤变得更厚，它会防止皱纹的生长，而且更重要的是，它会降低您得皮肤癌的几率。
In older men, the lower the growth hormone level, the sooner they die.
对老年的男性来说，通常他们的生长荷尔蒙指数越低，他们的生命就会越短。
So is growth hormone safe? There's a number of studies that have looked at children who have had childhood leukemias and pituitary tumors. So these are children with leukemia that need growth hormone replacement. And there's been no increased incidence in recurrence of disease compared to the general population.
现在说的是生长荷尔蒙的安全性。曾经有一个研究是给得了白血病的青少年做生长荷尔蒙的治疗。他们研究表明，生长荷尔蒙并不会增加他们的癌症的几率。
So the concern with growth hormone is its growth hormone. Will it cause a cancer to grow?
很多人他们担心的就是这个是一个生长荷尔蒙，那它会不会也会增加癌细胞生长的几率呢？
But when you give growth hormone back, you raise two things. We measure growth hormone by looking at something called IGF-1, and that goes up, and that's great because that's good for your cell division and your bones and your muscles and things like that. But the other thing that goes up is IGF-1 binding protein 3, and that triggers cells that need to be triggered to die. And so the higher the binding protein 3, the lower the incidence of cancer across the board.
我们在做荷尔蒙治疗之前检验的两项指标，一个是 IGF-1，一个是 IGF-BP3。IGF-BP3 是如果您这个指标越高的话，您的风险就越小。
So it's important when you have a growth hormone patient to actually monitor both things, because if every once in a while the IGF-1 goes up, but the binding protein doesn't or goes down, that may be somebody I take off growth hormone because I'm creating an imbalance in cell division and cell death.
所以在做生长荷尔蒙治疗中，这两个检验是密不可分的，因为这两个检验不能让他们太不平衡。如果他们太不平衡的话，身体里细胞生长和代谢的速度就不一样，它可能就会造成一些风险。
Where it gets a little confusing is that there are a number of cancers that actually make growth hormones. So that's important. It's not that the growth hormone caused the cancer, but these cancers secrete these growth factors. So when I get a patient who is in their 50s and 60s and they're not diabetic, because diabetes will increase falsely almost your IGF-1, so they're not diabetic, but they're 50 and 60 years old and they have a really high growth hormone level, then I'm worried as their physician that I may be missing a cancer in that individual.
对于一些50岁以上的人，如果他们没有确诊为糖尿病的话，他们的在这种情况，如果他们的生长荷尔蒙指标比较高，那医生就会担心他们会不会有癌症的可能，因为有一些癌症会导致我们的 IGF-1 这个指标变高。
This was an article that was in a journal called Growth Hormone Research, and at the conclusion of this is growth hormone is essential for normal life, and without it, life expectancy is shortened, energy and vitality is reduced, and the quality of life is impaired. The medical case for growth hormone replacement is proven beyond any reasonable medical and scientific doubt.
这个是一个研究，他研究了就是生长荷尔蒙在我们的健康中需不需要。
Okay, so what about menopause? So menopause in Asian women are a little bit different from, I think, menopause in American women. American women are miserable going into menopause. They so fear getting older. We live in a society in America where it's a very youth-oriented society, and so they look at menopause, they and I, looked at menopause with dread. But here, I think it's a bit different, and I think women in Asia present a little bit differently. Certainly, you seem to have less hot flashes, although that can be a presentation. You have a lot more body aches. So menopause, as your estrogen levels fall, you have a lot more inflammation. You hurt all over. That can be a presenting sign of menopause, as can hot flashes and mood changes. The China curve is in the yellow, so you guys, is it red? Oh, I'm sorry, it's red. So more aches and pains, and then a bit more irritability. So the irritability was something that came up in the Asian population as well, versus the hot flashes in the United States. Maybe it has to do with our diet or body fat or something like that.
我们这个图它表明的就是对于中国女性，它和日本、加拿大还有美国女性在更年期时候症状的对比。中国在这边是红色，中国女性和其他国家女性比起来，我们在更年期的时候， 潮热的反应少，但是身体会有疼痛感，还有易怒这种情况会比较多。
But why do we want to treat menopause? And I always say to women, when they'll come into my office and they'll say, I'm through menopause. And I say, no, you're just in menopause because menopause is a metabolic disorder. There are a number of metabolic situations that change with menopause. So it's a metabolic condition.
更年期对于我们来说是一个新陈代谢的障碍，因为在更年期的时候，我们身体的新陈代谢会有很多的变化。
Certainly we want to treat menopause because we can relieve your symptoms. But I always say it's really about preserving organ. So we want to preserve your brain. We want to preserve your bone. We want to preserve your heart, your skin, your hair, your joints. We want you to sleep well and have a better quality of life. So when you lose these hormones, you catapult into an accelerated aging. And so I say, at what age do you want to become old?
对于我们的对更年期的荷尔蒙治疗，它主要就是让我们减轻我们在更年期时候的一些症状，然后帮助我们达到大脑、骨骼、心脏、皮肤、头发、关节等健康。
We have a window of opportunity. So within the first 10 years of menopause, if I begin to treat you, I can improve your disease risk profile. I can decrease your risk of heart disease. I can decrease your risk of stroke. I can decrease your risk of osteoporosis and Alzheimer's. But it's essential that we start treatment within 10 years. Beyond 10 years, I've lost this opportunity to prevent disease.
最好的接受荷尔蒙治疗的时间就是在您更年期的10年之前，不是，就是10年更年期之后这个10年之间，因为在这个10年之后就能获得治疗的几率就会越来越少。在这个10年之间，您接受治疗的话，可以降低您心脏病、中风、骨质疏松等几率。
So there's new research out recently that talks about an enzyme, a chemical that's made that breaks down something called beta amyloid, which builds up in your brain with Alzheimer's. With the decrease in estrogen, this enzyme also decreases, thus the increase in Alzheimer's.
我们现在讲的就是生长荷尔蒙和雌性荷尔蒙和老年痴呆症的预防的关系。
So again, timing is essential. The earlier I start treatment with you and preserve your hormone levels, the better I can prevent changes.
所以说，在接受治疗中，时间是最关键的。越早接受治疗，我们就可以越好的保存您现在的荷尔蒙指数，然后让它得到提升。
This looked at how long should we treat women. So women who were treated with with estrogen long term actually had a reduced mortality, mostly through the reduction of heart disease.
接受长期，这有一个研究说明，长期接受雌性荷尔蒙治疗的病人，他们会死亡风险率降得更低。通常呢是心血管疾病的风险。